Biscuits,
Hacks and biscuits. Good. Yeah.
peas and crackers.
Doesn't matter where we live, you know, we're part of this club, so that's kind of cool.
Exactly. You guys have a great weekend.
It looks like we're getting underway. You know, good chatting with you all.
Very active group this morning. Please stand and join me in the Pledge of Allegiance. I pledge allegiance.
Under God, indivisible, liberty and justice for all.
And the four-way test of the things we think.
Things we think, say, or do.
Is
Is it the truth? Is it fair to all concerned? Will build goodwill and better friendships? Will be beneficial to all concerned.
Thank you very much. Good morning. Got a full house today. This is fun. Hopefully Bob Rose is here. Did I see Bob? Maybe. So this is a quote that Bob Rose sent me and asked that we use as our inspiration. So I thought it was a good one. How wonderful is it that nobody needs to wait a single moment before starting to improve the world? And Adrian, I actually put you on my slide so I won't forget you again. If you're there, I can't skip over you.
All right, good morning. And we're so happy to have Elizabeth Gallagher. Yay. Speaking along with Ann Dorshak. Welcome. And Bob Lipson from Conifer. And I'm sure to say a little something. And Tom Myers. Taking the place of Jamie so she can contribute to her for the new year resolutions. So he came in her place because she's still sleeping. And then we have Erica. Awesome, welcome. Pastor Christine, so glad you're here.
Thank you, Adrian. I promised you I would stop forgetting and I figured out a way to do it. Okay, Bob Rose also sent me a couple Rotarians in the Wild pictures. They're both, well, one is he and Nick, I see you here this morning, Nick, with their Rotary flag in front of a whale skeleton in the Bahamas, which was fun. And then also our refugee family who we support. One of the family members had a birthday party in January, so the refugee support team was there for that. So he sent those pictures. Please send these on to us. Not only is it fun for our club to see, but the district loves to see what we're up to and what we're doing. So send us pictures when you're out doing fun things with other Rotarians, please. It's not letting me do anything out.
You're right.
Thank you. And Dave, I know I saw you. Dave Laughlin. There you are. You weren't here last week. Super special thank you for all the work you put in for the bell ringing. I know that's a huge thing. All right, a couple quick president announcements. The 20th is the MLK Parade, and Rotary is going to have a group walking in that. If you're interested, there's quite a bit of information on the district's website. It's on the 20th, and I believe they're meeting at East High School, and there is parking available. So if you're interested in being part of that, visit the district's website. 2025 Foundation Dinner is coming up. Our Rotary International President, Stephanie Urchik, is going to be there. And registration for that does close on January 23rd. The event's not until February 1st, but it's going to be at Wings Over the Rockies. Really a fun opportunity. They have some neat things planned. So, and the opportunity to hear Stephanie speak in person, I've been told is really, really a powerful person to hear talk. And one more reminder that the Rotary International Convention is in Calgary this year, I guess now. I have not personally been to convention. I know we have some members who have, who say it's absolutely an inspirational and phenomenal thing to attend. So it's not going to be this close again very soon. So if you're interested in going, this would be a good opportunity. Denim and Diamonds. We have reached our first $20,000 match, which is really exciting. And we've just found out there's actually, I'm glad I didn't put a number on here, Katie, because we just found out we actually have more in donations than we realized. So we will report next week on where we are, but thank you so much to those of you who've supported us. And because we do have quite a few new members, I just wanted to kind of, and I'm not going to read it to you, you can all read. I just wanted to kind of let you know where the money that we go for this raises, or where the money we raise goes. It goes to all the programs that we support locally, in the US and worldwide. So everything from WASH and literacy, our Polio Plus contributions. So there's a lot of really good work that comes from this money. And we can't do the programs that we do without it. So thank you very much to those of you who've contributed. And if you haven't, please consider doing so.
Get your tickets. Get your tickets now.
Katie says, buy your tickets for the event. It's a really fun night. And one of my favorite things about it is we do all the fundraising beforehand. So it's really just a night about fun and community and having a really good time together. So please come out and join us.
Yeah.
All right. Do we have general announcements today?
Maybe my name is Linda. I want to thank the board, Mindy and Erica, for allowing me to make this announcement, okay? How many of you have started talking with a friend about Rotary and they're so engaged, they're so excited, they can't wait to come, and then you say 7:15? Anybody? Yeah. So what if? This is a what if announcement. What if we added an additional meeting time opportunity, not changing anything about anything that is happening now? What if, once a quarter, every other month, for an hour at noon, we were able to offer Rotary in person to a person who maybe is a mom, who can't get out the door in the morning, who is a business owner, who can't get here, whatever, chooses not to come, can't drive in the dark in the morning, okay? What if? Okay, so this is a what if announcement. The board said, why don't you ask Linda, is the membership even remotely interested, okay? Would this engage more people in our community? So on the 28th, Tuesday the 28th at noon, in this location, Sarah has graciously given this to us for free to come and just brainstorm the what ifs and what's possible for the club. So here's the deal. If you can't be here on the 28th at noon, please email me and say you're interested, or please email me and say, here's some questions. We know this has happened in other clubs and it's not worked. Or we know it is happening in other clubs and it is working. What are your questions? It's a what if investigatory. I am a trained investigator. Investigatory announcement. So let me know if you have any questions. Thank you.
I'm Jack Stapleton. I'm the reason why your website really stinks, because that's my job, but I have updated one thing on there. Please note that we have 8 tables seating 8 each, and we have more people than we have table room for. And our club size is more significant than what we can get in. So it's kind of hard to get to know people. That's why I've uploaded the most recent photo directory. It's on the website. It was actually run this past I think Wednesday, and unfortunately the new members yet haven't gotten their pictures up, Jason, so just get your picture out there. But you can download it, and by the way, it does require a sign-in, so it has your contact information as well as your lovely photos, so please check that out.
Hi, Richard Ayler, Echo Food Drive Chair. I just wanted to give a thank you to you all. We donated, I calculated the numbers this week, and we donated 1,200 pounds of food last year. And so thank you for all you do to bring donations, all your donations, and they are so appreciative. We've upped the times we do the food drive to once a month, and that seems to be working really well. So we're going to continue doing that. So there'll be the third meeting of this month, which is next week. So please bring your donations to next week's meeting. I'll be collecting them right out here, and I'll send an email early next week with the items they need. Thank you so much.
Well, Rita Carver, and on your table, you have a flyer for our book club, which is coming up January 23rd. It is a great book. It's a memoir of James McBride and his remarkable mother, who raised 12 children in the ghettos in New York. So I think you all would really enjoy it and hope that you'll read it and come. Please let Jen Bowmer know. And I think I finally got her email correct on here. So send her an email, let her know you're coming. She's going to fix us a soup or a stew, and then we'll just bring some sides for her. Also, our pickleball group is playing today at noon. It's beginners and intermediates, but if you're advanced and just want to come have fun, Chuck, we would love to have you. And one more, Rowdy Rotarians is, we're hoping March 13th, and we'll send out an email, let you know that for sure, okay?
Good morning, everyone. Erica Sprinkle. I have two announcements. First of all, Seniors for Wellness is hosting a, I want to call it, computer tech. It's a tech class at the library on January 15th from 12 to 2. And we actually need some people to come and help educate the seniors using their iPhones or their cell phones, iPads, whatever. So if you're interested in being a tutor or on techie and your techie stuff, please let me know. And that's Wednesday, January 15th from 12 to 2 at the Evergreen Library. Secondly, Deb Sandler has asked me to correct, last week she made an announcement for Wild Aware at Evergreen Brewery, and it's on the 16th at 6 o'clock. I think she said it was at 5:30. So if maybe you can just put that in the notes, that's at 6. And thank you to Katie for doing the coffee for me today.
Hi, for the new members, my name is Patrice Henning. I'm co-founder of an organization in Kibera Slums where 1 million people live. It's called the Center of Love Foundation. We are offering our service immersion trip in August, but doing a special trip beginning July 29th. Mindy and her husband Chris, their son Reese are already signed up. If you're interested in just learning a little bit more about it, we have an orientation that we're offering on January 25th at 10 a.m. Mountain. And if you would like to receive that, you can contact me by my email at patrice@thecenteroflove.org, and Mandy, that's CENTRE. And if you want to learn a little bit more about just what we're doing after February, our own Kurt Harris is going to be on the ground, I believe on February 11th, with my co-founders, visiting all of the fabulous WASH projects. If any of you have a gently used iPhone that you're not using any longer and could clean that off, wipe it off, and have it unlocked, I would really appreciate that. Our staff is all trying to go to the iPhone format. Thank you so much.
Morning, Rotary. I'm Dave Laughlin, and just wanted to give you the final report on the Salvation Army campaign. Number one, I wanted to thank you all for inviting me to help with that. I had a blast. I went out there a number of times and met a lot of new folks, and it was just a lot of fun. But some of the numbers that I want to go through real quickly for collections, we actually got 79.25, so quite a bit more than I had hoped before this. That was excellent. We had 43 members who donated at least 2 hours, and then Kurt Harris and Jen Vollmer and Erica Sprenkel donated, I want to say 4 or 5 blocks of time. So we're talking about 8 or 10 hours they were out there. Just a phenomenal job for those guys. And then we had Chris Davis, Rita Carver, Jill Marill, Jennifer Herrick, and Chris Hodo, and Jessica. Oh my word, I'm gonna mess up your name badly. It's Paula's Kausing. But they all had donated in excess of 2 times out there, so 4 hours. So congratulations to all of them. Couple of the things that I'm going to be talking to Kara at the Salvation Army about. The big thing is there was some discussion about should we be covering both doors as opposed to just one door at the Walmart. And I'm willing to to do whatever it is the group wants, but it does look like the days that we had double coverage, we got more collections. Our biggest day was December 14th. We got over $2,300 that day, and we were covering both doors, so it does make a difference. Let's see. The one downside I would say would be the 4 to 6 shift. Nobody wanted to do it. And so I don't know, I'll talk to Kara about it, but maybe we can adjust hours or whatever, but there were 12 slots and we filled 7 of them. So we missed on a few of those. There are a bunch of, I've got a sheet on the tables. You can look at the instructions that I think we should have before we start the campaign next year. And then signage was something, Kara was telling me that over 30% of collections come from a QR code, and it was super small and most people probably missed it. So if we could, kind of increase that, and also advertise the we're Rotary, and we're the volunteers out there, because a lot of people didn't know that. But anyway, I just really quickly wanted to also offer a special thank you to Erica. Thank you so much for having me in and doing this. It was a lot of fun, and you guys did a great job. Thank you all.
Well, good morning. I'm Peyton Thomas, and I just want to first of all say that I am really stoked to be a part of the Evergreen Rotary. I hate mornings, and on Friday morning, I pop out of bed. I'm not joking. I am so excited and thrilled to be around people who believe that anything is possible. And I just think that this room has so much power and potential. It's just overwhelming, and I'm super happy to be here. So thank you for that, and thank you for caring about the world. I am leaving next month for Uganda. I grew up there. I grew up in Uganda from the age 12 until I was 16. I've been going back my whole life. I love it very much. And so a few years ago, my mom and I started Speakers for Africa, a 501c3 nonprofit that helps vulnerable students in Uganda. And this time we're going back with a small team to build a pit latrine for a school, and then help another school as well. So I just kind of want your general support and just let you know what I'm doing. And yeah, that's about it. So thank you.
I love our announcements because it just shows what our club is involved in and really making a difference in the world. So thank you, everyone. Okay, Yvonne, do you want to come up? And as Adrian said, Yvonne is here joining us today from the Conifer Rotary Club, and she has some exciting announcements for us.
Good morning, Evergreen. So, first thing I want to tell you guys about is the Rotary Action Group Mental Health Initiative that District 5450 has. We have a Wheels and Sparks presentation on the 14th at 7 o'clock, and we would love you guys to be there, learn a little bit more about what we are going to be doing. So my second thing is I want to say thank you. Thank you, thank you, thank you for the donation or grant. I'm not sure which way that went. But that allowed us to buy parenting EQ kits for our event MindFest. And MindFest is coming up. It is a mental wellness fair, and hold on a second. It will be February 22nd from 10 to 2 at Our Lady of the Pines. It is really going to be a lot of fun this year. I think we have actually more hands-on activities that promote mental wellness than we've had in the past. One of the things that we are really promoting is our dance and movement workshop and how that affects your mental health. And we have the Rocky Mountain Compassionate Communications Network doing our role-playing part. So those are going to be really fun. And if you want to volunteer, I sent Mindy the link to our Sign Up Genius. We would love to have you there. If you don't want to volunteer and you just want to come, we would love to have you.
Thank you for joining us today, Yvonne. And the link to sign up to volunteer will be in the announcements that Mandy's doing. So everybody will have access to that. So I think our next thing is Chris. Very
Sitting right next to her.
bright red.
Good morning, everybody. I'm Chris Kazian. Honored today to introduce our speaker. You remember Chief Weezy and I were here a while back ago. We talked a little bit about the fire service, and we I hate two things: change in the way they are. We're very traditional in the fire service, and we are very reactive. And this program today is an example of everything that's not what I just said. We have taken paramedic services where someone calls 911 when they're hurt, and we respond, we take them to the hospital, and we go back and we get ready for the next one. And that has been our mantra for as long as ambulances and paramedics were around. And years ago, some folks with very bright minds said we could do something different. We could be very proactive, and we could make a difference in people's lives, help people age in place, and create an opportunity to give them the dignity and respect where they live and where they can thrive the best. And took that with a blank slate and have created programs around the country, but we're talking about two great programs right here in our backyard. So we have Elizabeth Gallagher from Clear Creek EMS. We have Annie Dorchek from Evergreen Fire, who both are doing a program we call Community Paramedics. So honored, we'll bring up Annie and Elizabeth to speak about their program. I'm excited. They're doing amazing, amazing work. So thank you both very much.
So I'm Elizabeth Gallagher. I actually did a presentation about the chat program for the Clear Creek Rotary. And then they said, oh, will you come to Evergreen and talk about it too? And I said, well, sure. And I think we should involve Evergreen Fire because their part of their program covers the majority of Evergreen. So the chat team stands for Clear Creek Health Assistance Team. And we have 3 functions in Clear Creek County. The first is co-response, which is, so I'm a licensed clinical social worker. I've got the mental health piece of things. So co-response is when you pair a mental health professional with law enforcement on mental health, behavioral health related calls for service. So we go out with all the jurisdictions in Clear Creek County on mental health related calls. We also function as an alternate response team. So after many events throughout the nation, people are realizing, hey, actually, maybe we don't need to call law enforcement for every mental health related call. There are always going to be calls that do require law enforcement to secure the scene, make sure everybody's safe, keep us safe, all of that stuff. But there's also a lot of calls that don't require police at all. And so our team can get dispatched to those calls. They get screened still through 911. And sometimes we can go without. And then the third function of our team is community integrated health. And that is where the kind of the crossover with Evergreen Fire happens. Jurisdictionally, the first two functions of our team of co-response and alternate response, we've got the same jurisdiction as the Clear Creek Sheriff's Office. So we do hit Evergreen. For our community integrated healthcare piece of things, we've got the jurisdiction of Clear Creek EMS, which is where Evergreen Fire covers the Clear Creek side of yes, thank you. So community integrated health, and actually I'm gonna talk. Oh, sorry. Yeah. I'm actually gonna hand it over to Annie to kind of give an introduction about what community integrated health is. When I did this presentation in Clear Creek, I kept this part really short because there were lots and lots of questions. So I want to make sure that we have time for all those questions, but I will hand it over.
Thank you, Elizabeth. So I'm Annie Dorchak. I've been with echoes. Sorry. I've actually been in EMS in my 38th year as a paramedic. But to build on that, the past 6 years as a community paramedic in Evergreen has been the most satisfying 6 years of my career. Because I'm helping people, like Chris said, age gracefully and with dignity on their own terms, in their own home, as long as it's safe. So I kind of we make paramedic house calls is probably the best way to describe it, with stress, fall prevention, and health maintenance. So all you Evergreen residents that were around in 2016, you actually asked for this, if you don't remember. We had a mill levy vote in 2016, and we had town hall meetings where the residents of the community that attended those meetings said, teach us how to age in place and be safe at home. When the mill levy passed in 2017, we built this program. So our first year, we made 38 visits. Last year, we made 1,350 visits. So, and it's not just me, I have an amazing team. So it's just showing that there's a need in our community. And when you asked for it, you asked for the right thing. So some of the things we do, like I said, fall prevention in your home. We will come to your house, we'll do a walkthrough with your house with you, make suggestions. And I like to say it's for 5 days, 5 months, 5 years. Things like shower bars, because you don't want to be naked and fall in the shower and have Chris show up and help you out of the shower, right? So those are some of the things I talk about, obviously with some humor, because sometimes, aging's not for the faint of heart. Trust me, I'm entering that level these days. So we help you do it and do it in your own home. We have probably half of our census of people we see, we help them set their medication bottles up. I know how hard it is to read those things and understand the instructions from the doctor. Or maybe you come home from time in the hospital and you just sign those papers and said, let me go home. And then we help you go through those aftercare instructions. Sometimes we visit you once and we're done. Sometimes we visit you once a week, once a month, whatever you need. We also bring in the fire prevention division and make sure you have CO alarms and smoke alarms. And we work really closely with INER with that. We work really closely with the neighboring departments. Patrick, their community paramedic, and Elizabeth, we get together once a month and chat. So we work with, I think Inter Canyon's program moved, Foothills is building a program with Inter Canyon. So we do a lot here in Evergreen, but we're working to push this statewide as well, so. It's a privilege to do this in Evergreen. I have some flyers. Oh, I forgot. We also have a shed, a loaning shed, where we loan out durable medical equipment. And we also accept donations like of walkers, bedside commodes. Stuff that'll fit in our shed. If it's equipment we can't use, we give it to Project Cure. So like someone gave us some oxygen concentrators. I do not have the technical ability to manage, make sure they work, but Project Cure was all about it. So what else can I tell you that I didn't tell you?
Who was community paramedic of 2024?
I was gonna say something. So I was voted as community paramedic for the state of Colorado for 2024. Thank you. He knows I wouldn't have said it myself. But are there any questions?
Let me say too, a big piece of the community integrated healthcare in the Clear Creek County side of things is resource navigation and helping people get access to care. You know, Clear Creek is a little bit farther out of the Denver metro area. People are a little less better resourced and there's just fewer resources there. So a lot of what we do is, oh, you need transportation. Let's get that set up so that you can actually get to your doctor's appointments regularly. Food insecurities. Okay, let's figure out how to make sure that you have a good nutrition so that you can stay in your home and age happily and well. So that's a big piece of the work in Clear Creek County. Yeah, go ahead.
One of the microphones so I can run into it.
Oh, sure.
That way it's
Thank
easier
you.
questions.
So I can get Rob.
I have a little bit of a question. I'm not sure if it's in your realm or not. I am a member and that live in Bergen Village, Rocky Mountain Village. And I'm on the 3rd floor. Now, there are people that have difficulty walking, even in independent living. But these people, when when a fire situation develops, they close those big doors. They cannot be opened. They're very, very difficult.
Yep, haven't gone down.
And I don't know what we can do about them. You know, I try to build with weights, but I'm only up to between 5 and 8 pounders. And trying to open those doors is very difficult. So we worry about how people can get help during an emergency and who do we contact?
Well, that's a great question. I'm glad to see you're up to 5 to 8 pounds. I'll come by. We can do some more lifting. I need to lift. I'm up to 10 pounds, so we're good. Those doors do have to shut by code because when the fire alarm goes off, that they shut and they isolate the building to keep smoke migration and fire from moving. So I don't have a really good solution, except it's there to protect you. And ideally, it creates a barrier for safety for you. I don't know how to tell you to get those doors open any better, easier.
Maybe a little thing you can call Alexa.
There you go. Sure. You call Alexa. That was gonna be my second suggestion. Or Siri. Open the door, Siri. Let me know what we can do to help. I can come by and help you. But the doors are shut. That's nothing I can do about.
Used to this. My mom lived with us till she was 97 and passed, and then we had a 92-year-old lived with us till he passed. Both of them wanted to stay in their homes, and they did up till they were 90. What assurances do you give people? Because they're, I'm sure, resistant to have you even come in because they think you're going to kick them out of their homes. What can you do to make sure that we can tell them, no, you're going to be safe there?
Maybe. So honestly, that's been our biggest hurdle since day one, is because I remember when my grandparents, it's like back then, what you did with aging adults is you parked them in a nursing home somewhere. So I appreciate that as people start to age, they remember that. They're like, these paramedics are gonna come in my house and they're gonna say, I have to go live in a nursing home. That's not what we do, and that's why I said, meet me. Because our goal is to help you live safely in your home. Safely is the big piece, as long as you can. And that means resource navigation. Like, maybe you can, it's actually cheaper for in-home care than going to an assisted living, if you do the math. We can pick up medications for people. We will go to the food bank and pick up their food bank order, those type of things. Because transportation is an issue up here, we all know that. Because we all miss the yellow house, and thank you, Seniors for Wellness, for working to make that a little better with the transportation piece. So truly meet me and my team. That is the hardest thing for us to do, is to get in the door. Word of mouth has been amazing to help us get in the door. But if you talk to people, Tom knows of somebody that once we get in the door and they get to know who we are, they realize that our goal is to keep them there as long as it's safe for them to be there. And we work with the family. One of my community paramedics does not hesitate to call the patient's physician and say, okay, Mr. Jones needs this. This medication is not working for him. He has a wound on his leg. Would you write orders for me to do this? So my team is empowered to be an advocate also for their patients with their physicians. So it's so hard for us to put on paper what we do, or for me to stand up here and say, we do, like, she kept reminding me, oh yeah, we'll do that too. So it truly is meet me or meet my team. Because I don't have another good answer for that.
I would just say that's actually part of the way we get in the door. I think the clientele that we work with, I call them mountain people, fiercely independent, right? And a little bit of like chosen self-isolated a little bit. So we sometimes start the conversation with, hey, is it important that you stay in your home? You know, you've been transported to the hospital 3 times in the last couple of months. Is it important for you to stay in your home? Yes, okay, we want to help. And then that kind of gets the door open a little bit for that as well.
Good morning. Thank you for all the help that you've done. I know many people who sing your praises. They were very skeptical, and you provided a solution for them being able to stay in their home. So I know with half a dozen people who would stand up and give testimonies for you. So thank you for your work. And my second is, if people wanted to volunteer a month, you know, once a month, a couple times a month, what should they do?
It's hard for us to take volunteers for what we do. What we're working on building is the shed piece. So it would be volunteers to help us with the shed and organize the shed. I don't know if any of you have heard about Dave's Walker down the hill with our Vada fire. I'm really worried I'm gonna get that big and not be able to handle it. Like, they went from a shed to a bay to like a whole building at the fire station. So just because of the medical regulations with what we do and the state rules, the volunteers we would welcome would be someone to help us with our shed. At this point in time, that might change down the road, but currently, and I don't know if Elizabeth has other.
No, same answer. We don't do just the confidentiality, sensitivity, all of that stuff. We work under a community integrated healthcare services license. We've got to have employees, credentialed employees, to be able to do the majority of the work.
Thanks. 2 things. One, to your point, Kimra, you know, Mount Evans has a huge volunteer program, and they do this kind of service. Running volunteers is a huge job. So I can understand why you guys can't do that. But if you have time to volunteer, you know, reach out to Mount Evans, because there's home health aides and there's all sorts of things you can do as a volunteer through Mount Evans. 1. And I'm reading this and seeing that what you're doing is basically free to our residents, which is pretty phenomenal. Even on a monthly or a regular basis, it's all free.
And that's because of the mill levy. It's like, you guys I mean, essentially, your tax dollars pay for a program. Because you asked for a program, and she's right, we do not charge anybody for anything that we do. Yes. So they just did the sunset review. I'm learning a lot about the legislature and how all that stuff works. The sunset review is complete. The report was submitted to the legislature with suggestions for things to change. One of the big ones I'm pushing is allowing EMTs. Currently, they're only paramedics or nurses, but a CNA could be a community medic. That doesn't make sense to me when an EMT cannot. However, that's one of the things we're pushing, which would, again, I mentioned the statewide piece, which would allow these type of programs out into the rural and frontier areas more now than it is available, because there's a lot less paramedics when you get away from the I-70 and I-25 corridor. So we're pushing really hard for that and looking to change some of our rules to allow us to truly do more paramedic house call stuff, like call the doc and say, hey, we did an assessment, they need an antibiotic, or, you know, can we just put some stereo strips and throw a couple sutures in this person instead of making them drive all the way down to the hospital. So yes, sunset review's been done. The recommendation is to continue it for 10 years before the next review. And to extend, right now we have to renew every year. To extend that renewal to every 2 years. So hopefully there's some changes, but yes.
It'll always be free.
Oh yeah, it'll always be free.
Always be.
I think I have a question or an observation. Okay, I'm a vaccine urologist. They seem to be specializing in patients over 70. As a urologist, one of the sad things I see at St. Anthony, the hospitals I cover, is the social aspect of aging. And what I'm seeing is that you're correct. By the nature of how we live in the mountains, we have a degree of isolation. But that isolation includes eventually poor support. Some of us are fortunate to have family nearby. Many of us don't. And what I find is that often when a patient comes in, typically a fall, and I see them when they fall on their pelvis, it's amazing to find that patients are sometimes found 24 hours after they've fallen. And because they have no contact with people around them. And I think that our biggest problem, your biggest problem as a social worker, is to foster connection. Because the services you offer are typically abandoned. Someone has to check that person. If they fall, what typically happens is the discharge plan comes up.
Yeah.
Do you have anyone to support you? If you don't have that, often the difficult decision is a scramble. Where does this patient go? And I think that's the most important element of the programs you have.
Absolutely. And I think that's a big piece of getting the word out, right? So people understand that the program, the way Annie's program has grown, ours has been in place a lot less time. But the way she talked about how it grew is about making people aware of it, and not just people, community members, people at the hospitals, social workers at the hospitals, urgent cares, primary care offices. We've got a pretty good kind of collaboration with the primary care office up in Idaho Springs. And then, you know, the community paramedic helps navigate that healthcare piece so that they can kind of be that bridge between the doctor or the nurse and the patient in terms of, hey, like she talked about, Sarah gets on the phone and says, hey, this med is not working. Hey, they've got a wound, right? That kind of stuff would normally require a, hey, let me call, make an appointment. And many people don't do that. The other piece I just share, Clear Creek County has what's called Safe Call. So this is a program that was established actually by the sheriff's office, but for peace of mind. It's a daily call from initially, if you sign up, you as the participant call into dispatch every day and just say, hey, I'm good. If they don't get that phone call, dispatch calls you. And if you don't respond, they send chat.
Or call us.
Or
It's our patient.
or call, yes, as sometimes we've got the jurisdictional limits kind of there. But so that's that isolation and that kind of
lacking social supports, there's still a way to make sure that that person didn't sit there for 24 hours, fallen, wounded, whatever that looks like. So that's kind of a cool program that we've got.
And I'm gonna address what you said a little bit too. So I went back to school and I got my master's in social work to focus on the healthcare aspect of it. So every new intake for our patients we do is called a biopsychosocial evaluation to find out who that support group is.
Yeah.
And what resources do they need. We also do, because most of our patients are aging adults, we do the geriatric depression score and see how they rank there. If they use substances more than maybe they should, that assessment is included in there too, to ask the questions. So we know which resources to look for. They sign forms that allow us to reach out to their primary care physician and discuss those results. And yes, sometimes people lay on the floor for 24 hours or longer for two reasons. One, they don't know anybody, or two, and please tell everybody, they're not bothering us when they call us at 3 o'clock in the morning. Because we get that a lot. Oh, I didn't want to bother you, so I waited. Please don't do that. I just lost my whole train of thought. Oh, so some of the people we visit, truly, we just visit. For that exact same reason that you brought up, the social isolation, that word. For that, because they don't drive, they can't get out, they don't have family, or family lives in another state and is not nearby. There, I can think of 3 people off the top of my head that Jeff visits, that all he does is visit. So yes, we do that. You do not have to have a medical complaint because loneliness is an epidemic in the older population.
Oh, hi.
Hi.
Thank you for what you're doing, and for serving our community. One of the questions I have is, the scope of the number of people that you're able to help. And, it seems to me that there's probably a whole lot of people that you're not able to help. And so does your program need to expand, or, can you address how the community, what the situation is?
I just told Chris you sound like our fire chief. He just asked me that the other day. So currently, our team is myself, I'm the captain over the team. Then I have 2 full-time community paramedics. And I have 1 part-time who's a full-time 911 paramedic and works after his shift. Our current census floats right around 65. So between all of us, we see 65 individuals a month in some way, shape, or form. Chief Ouija just asked me that question the other day, and I was like, I don't necessarily have a good answer because our population continues to age and our population continues to grow in the Evergreen area. We're working on some fine tuning. We will most likely hire another community paramedic in 2026. We don't know, honestly, where it goes. We'll keep building and growing as the community needs us. And that's one aspect of the community paramedicine piece. And you notice that Chad is different than us, where they have a lot of the behavioral health and mental health piece that we don't have because we don't need it. We have not seen the need for that in this area. If that need occurs, we will work on more of a co-response or alternative response program. So community paramedic programs or mobile integrated healthcare, if you Google that, Colorado just came up with a cool phrase. Each one is individual to that community. So if our community keeps continuing to tell us that we need more support for aging adults, then our program will continue to grow. We will look for grants. We will find ways to help financially support the program so it doesn't become a huge cost center for the fire department. Because like I said, we don't charge for our services. The fire department supports it. You guys supported it when you approved that mill levy in 2016.
So I think the biggest thing is these programs are designed to prevent the emergency services. We know those are way more expensive.
The visits to the hospital, all of that is way more expensive than the 2 community paramedics that she's got full-time, right? So that's why it's free and is intended to remain free, because we're taking that burden off of emergency services. That's the goal. And so that's how we know. So each program is going to look different according to the community, and the needs of that community and the culture of that community, and kind of what they will accept, right? Some communities I've worked in want the police to come at every call, right? They have that kind of relationship. Not every community is like that. So it's really customized according to the community, and the programs look different everywhere you go.
So you actually just hit on the topic that I was gonna ask a question about. I know there's a lot of variables, but as you've gone from 38 calls to 1,000 calls, have you seen the correlation, reduction in reactive calls versus proactive calls? Can you document that and show how effective it is?
That's a work in progress because it's really hard. I can document it on our individual 66 people that are currently enrolled in the program. So for instance, I know we fell twice yesterday, but there's one individual that fell almost every day. And until one of our community paramedics talked him into letting her come and visit him, it went down to like once a month. So we were sending paramedics and firefighters to him almost daily, down to once a month since Sarah got involved. So I struggle regularly on ways to, I don't know, quantify, qualify my data. I mean, I know that we're making a difference. And being able to pull that response data out of our documentation software has been a little bit of a challenge. But if we know those 66 people are not calling 911 as often as they did before, we know we could make a difference for 66 more people. Did I answer your question?
Yeah, and in addition to that is the amount of resources it takes. Like I know we have a neighboring multi-family property, and once a month I see 6 emergency response vehicles, 3 cops and 3 EMS vehicles up there. I think it's excessive. If you do the proactive calls, the cost has to be so much less. Is there any way you document that?
So, a great question. But yeah, the question was just like, is this program helping reduce costs of emergency response, which is expensive and sometimes excessive in your words? It is challenging for us to figure out how to do that, like fire prevention. How many fire inspectors do we have to go out and provide code enforcement, do things to prevent fires that we never know might have occurred? You really don't, but we do know in places that do not have fire prevention and do not have active education programs in the schools, teaching kids stop, drop, and roll, don't play with matches, one of those things. You see a higher incidence of fire. So we know there's a correlation. How and exactly much is above some of our fire pay grades, if you will. Those are data analysis people, and we don't have the funds to afford data analysis people, so to speak. So we're trying to always figure out, how do we balance the money you entrust us to take in to provide emergency services, the reactive part, because when 911's called, we were at a fire the night before, 3 o'clock and 1 o'clock in the morning. 4 days before that, we had a fire at 3 o'clock in the morning. You got to have people ready to respond to those because they're going to happen. But I can tell you, we would much rather have a strong community paramedic, a strong fire prevention program, and never have a need to call 911. But we also have to have the reserves there. And so it's a constant balance. And that mill rate in 2016 was done to help produce these services. But that was 8 years ago, and we're going from 38 to 1,300. We want to go to 2,600, and we want to make sure we're doing it. So at some point, the mill rate, the money, where we have to ask for more someday to continue to do more as we grow more, as people demand more. So the folks that Annie spoke to that said, hey, we didn't want to bother you. Those people are less and less. There are more people that are saying, hey, I pay taxes, come here and fix my problem. Hey, I can't figure out why my stove isn't working. Well, it's not plugged in, sir. Oh, well, can you plug it in for me then? You know, I mean, like, I say that, but that's really, and so it's a changing dynamic. And so we have these two diabolically opposed kind of cultures. And they're much more needy, if you're at, I said that nicely, they're much more needy in today's world. I stubbed my toe. I don't feel good today. 911, come help me. What's wrong? I don't know. I don't feel good. I haven't felt good for 4 days. Do you want to go to the hospital? I don't know. Should I? We spend 40 minutes there with the 3 EMS units, the 3 police officers to find out that the person has the sniffles. And many people in this room would have never called for that. Conversely, we have many people that are on the floor for 24 hours that are bleeding, that are in significant pain, that don't want to bother us. And we're trying to change that culture. It's very difficult when you throw in the mental health component they're doing. The work Mindfest is talking about trying to prevent, the thing on our table that talks about the number of overdoses and suicides. Our world is not getting any simpler. It's getting more complex. And this is a solution to helping be just another piece in the wheel of creating a better world, as Peyton spoke to this morning. We are all in this together, but we can't do it alone, and we can't do it for free. We're providing it for free. We're all contributing, but we need to figure out how to make more happen.
I guess you know what, I have one piece that kind of speaks to what he asked about. So one piece of data that we really pay attention to, and it's not just Evergreen Fire Protection District, it's all the surrounding fire departments. One of the top 3 reasons for a call to 911 is a fall. So this year, we're also partnering with Mount Evans Home Health to develop a fall prevention program. And myself and my community paramedics, if we're not busy on a visit, we will respond to a fall or with assist. That's a 911 call to see if we can prevent that from happening in the future. So get back to me next year and I'll let you know if we made a difference.
Gosh, I know that there's a million questions and unfortunately, I think we have to wrap up. So, thank you so much, both of you, for being here. You may know Rotary is working very hard to eradicate polio from the world. So as a thank you for your time this morning, we'll be donating 60 polio vaccine doses in your name. So thank you very much. Thank you, everyone. Please go out and share the magic of Rotary with the world around us today and always, and we'll see you next week. Ding. You are.